An outbreak of flu in the country and the rising positivity rate in the last 5 days from 0.09% to 2.2% recorded today has seen some experts warning of a possible new COVID-19 wave. This after 32 people tested positive for the disease in the last 24 hours, bringing a total number of confirmed cases in the country to 3.6 million. And as Emily Chebet now reports, some medical experts are, however, dismissing a possibility of a sixth wave, citing vaccination, immunity, and previous infections as well.
The past 2 weeks has seen a spike in flu cases in the country, but at the same time, a steady rise in COVID-19 infections. The country has also recorded a rise in positivity rate, which some experts expressed fear it could be an indication of the sixth wave, as predicted earlier. On the 18th of this month, the Ministry of Health recorded a positivity rate of 0.9%. The following day, on 19th, 1.6% was recorded. On the 21st of this month, a positivity rate of 2.1% was recorded. The latest that was released today, the Ministry of Health recorded a positivity rate of 2.2%. But despite the increase, Dr. Ahmed Kalebi, a consultant pathologist, says there is no cause to worry.
There are hundreds of viruses that can potentially cause flu. We have the common cold, what we call rhinovirus. We have influenza type A, type B, RSV virus, so many other viruses. Now COVID, we even have other coronaviruses. So this COVID-19, SARS-CoV-2, is one of the viruses. But interestingly, right now, in many countries, and certainly here in Kenya, the flu that we are seeing, the respiratory infection that we are seeing, is not because of COVID. It is because of other viruses, including influenza A.
According to Dr. Kalebi, the 15th advisory dated 25th of March 2022 by the Lake Region Economic Bloc Committee on COVID-19 predicted a sixth wave of COVID-19 between April and June 2022 failed to factor in the immunity of a majority of Kenyans based on the vaccinations and previous infections.
I don't expect us to get into another serious surge or a serious wave because of the understanding of the disease. Most people have become infected. More than 80% of people have had exposure to COVID. So as a result, most people have some immunity because of past infection. And then secondly, a lot of people who are potential super spreaders, healthcare workers, first line responders and so on, frontline workers, most of them have gotten vaccinated.
Amref Health Africa CEO Dr. Githinji Gitahi says based on the rise of the positivity rate in the last few days, it is likely that Kenya is facing a sixth wave, but he too believes that with the immunity that Kenyans have acquired, the wave is likely to be mild. Dr. Gitahi challenged the government to enhance the vaccination process by availing vaccines closer to the people, as well as training of pharmacists on how to administer the vaccines in order to allow a 24-hour vaccination process across the country. Emily Chebet, Citizen TV.